Mental health and behavioral care in rural areas is certainly, I think, a huge concern for the state of Colorado. Particularly here in the Western Slopes, we've had a huge deficit in mental health resources, particularly in the rural areas, but even in Grand Junction, which is a larger city, they have had so few inpatient beds for mental health that they have struggled to cover all of the needs that they have.
One thing that would be nicer if we had a way to integrate it would be more mental health services. Mine Springs, we have a care compact with them, but because of our location and number of people, they are only able to staff it with one counselor 1 day a week. And then the rest of the time they use telehealth, or I think there's just not enough of them to go around. And if there are, convincing them to come to a rural area, it's a tough sell sometimes.
So we do a lot of psychiatry visits by telemedicine at Mine Springs. So even trying to get a psychiatrist via a TV in a room in a place that they could see someone will take 2 to 3 months. We really don't have anyone uniquely qualified for youth and those kind of needs that proactively would prevent a lot of hospitalizations, suicides, suicide attempts, drug overdoses, all those. There are very few facilities in the state that will take kids that have kind of special needs that way. And so we had someone here that it was going to take a month for him to get urgent care because of how full our hospitals, and that was including the Denver area. This was having to transfer him to, an urban area. So this is kind of the mental health crisis of being in Colorado right now, is that mental health is not the priority that it should be. And certainly for our youth, that's a big concern.
Healthcare in the rural communities is all about collaboration, and I believe collaboration will help us to solve these issues. Collaborating with law enforcement, the schools, the Center for Mental Health, local therapists, that's how we'll make a difference. And I'm happy to report that that has increased access, whether you're talking about the hospital placing behavioral health therapists within the clinics, so that they are integrated and there can be a warm handoff when the patient comes in. But also the Center for Mental Health that serves our region has constructed a crisis stabilization unit to provide better access for those that are in a crisis situation. The local law enforcement now has a therapist riding along with them to respond to domestic violence calls, to respond to situations in which there's a mental health or behavioral health component. And so you're providing early intervention. Prior to us implementing some of these programs, mental health visits to our ER outpaced trauma visits. That's really quite remarkable. We had patients that unfortunately would stay in our emergency room sometimes upwards of 5 days because we did not have a safe place to send them to begin treatment and to help them get stabilized. Also, many of them were ending up in our jails, and I think that's a real shame. Somebody in a mental health crisis should not be in the jail, and they should not be long-term in the emergency room. Those are not places that you start therapy, that you begin to start your recovery or your stabilization.
Our mental health providers that are actually in our clinics, so that they have that warm handoff. So a lot of times what might happen in a preventative care setting is you say, I'm not feeling good, or that, I am having depressed symptoms or whatever it is, and that kind of gets kicked down the road, and where we're able to have those providers, those mental health providers or behavioral health providers in our clinics, and they can have that warm handoff right there while that patient is still in the clinic.
I do believe that our patients are more at ease seeing behavioral health here, because if you go for the Center of Mental Health and you're sitting in their waiting room, everybody knows you're there for a mental health reason. If you're sitting in our waiting room, you could be there because you're here for a strep throat, you're here for a diabetic follow-up, you're here for mental health, nobody knows. And so that's easier for them to come in because it's not so taboo, because I think mental health really is a taboo.
People don't follow up with mental health very often if they have to go to another building, to a whole different center to start a whole different referral process. Having integrated behavioral health care within the primary care office destigmatizes it, it normalizes it, and makes it very evident that most people have problems with their sleep, and lots of people get down and people get sad when they lose a spouse, and it makes it much more a normal process when you offer these services in a primary care clinic without having to go down the street to see a therapist or a counselor.
I truly believe that you have to treat the whole person in order to lead to the best outcomes. Therefore, you cannot separate the mental health and behavioral health from the physical if you really want to be as successful as you can be in the community.
People are starting to understand that substance abuse, mental illness, these are part of healthcare, and this is part of being healthy and being, you know, holistically in a good place. So we can't just chop everything up and say, I'm just here to treat your hypertension, when, you know, they just maybe lost a spouse and their blood pressure is the last thing they're thinking of and not controlling it well. You know, we kind of have to go to their level and whatever their needs are. And behavioral health is huge.
Integrated care, I think for me, is treating the total person, treating the whole person. And I really believe it's the future of healthcare. And I think it's been really quite well received by our community as well. Behavioral health has a huge future for physical health.
She's now here a full day a week, and she says like her no-show, rate has been lower than we've seen with any of our therapists, here and everything. And she is available. Like when I schedule a patient on Wednesday who I know has some mental health issues, I can make sure that she meets them, that they get together, and so that patient feels comfortable. If I say, hey, do you want to go talk to Jennifer? They know who Jennifer is. She's not just a therapist, she's a person that they've already met and they connected with and they feel good with. So it is so awesome that she's here and that we have that, because it's hard to get people to go see a mental health specialist.
Sometimes I feel like there's not enough time in the day. We day in and day out, we're fairly busy. Being the only mental health agency in the southeastern region, we can get pretty high caseloads. Right now I'm probably up to 65. It could go higher than that, depending on the need. Yeah. The stigma will probably always be there, but I think once we integrate more with letting people know that hey, our brains run our whole bodies, that why wouldn't you go get help for that? So if you broke your leg, you would want to fix it. So if your brain's broken, hopefully you'd want to fix that too.
That's the biggest thing, because they think, if you talk to a therapist, there's something wrong with you mentally, or you're crazy or something, but it's not. I figured at first I was kind of I don't know, and then I started talking to them, and they don't judge you like you're crazy. They kind of talk you through it, and they kind of tell you, well, you're here for a reason. You're not imagining that you're sick. I'm sure you're in a lot of pain, and nobody can understand that. Well, Heather kind of, she said, well, you need to talk to somebody or anything. There's people here that we can refer you to. I said, sure, fine, I'll do it. I said, I'll see what it's like. At first I was kind of reluctant to do it, but I said after a while, a couple of sessions, I said, you know, this is kind of helping me out, you know, because I don't have anybody to vent. Like, I can't tell my wife, hey, I feel worthless, but she'll say, oh, just in your mind, you know, and whatever, but it just goes by the way. But if somebody else that's a professional like she is, I would, you know, listen to her and say, okay, maybe I'm not just as worthless as I thought I was. You don't understand my life. I've worked all my life, and I've been there for my family, and then all of a sudden it's taken away, and then there's a big part of your life. It just bothered me the most because I couldn't work, and that's hard. You work all your life, and then it's taken away from you for some mysterious reason. You're sick, you don't know why. And talking to her would, I think, helped me out a lot. I mean, you know, you have other problems, you know, family problems, and she listens. You know, she doesn't judge you, and that's a good thing.